I'm Jane Copier, and you're listening to Happy in the Middle, a podcast for Christian women who want to make the second half of life the best half. This podcast is all about helping women to reignite their spark and step into their divine power in order to create deep and connected relationships and also find that fulfillment and satisfaction they crave. So, if you're ready to grow, join me and learn how you too can overcome guilt, resentment, disappointment, and enjoy the fruits of creating a life well lived. Let's go. Hello, my friends. Welcome back to the podcast and episode number 23, Hormones and what you need to know now about your midlife health. Oh my goodness, today's topic is so important. If you've suffered from hot flashes or other symptoms of peri or postmenopause, you know how deeply it can affect your everyday life. Far too many women in this phase of life get depressed because they feel so dang rotten and they can't sleep and they lose hope. And then they're put on antidepressants rather than giving them the actual help they need to feel physically better so they don't get depressed in the first place. I am dedicating today's episode to my mom, who suffered way too many things for way too many years because of a lack of hormone therapy, because her doctors told her that she couldn't have them because they caused breast cancer. So, how did we get to this place where women have been denied vital hormone therapy for the past 20 years? And what do we do right now to fix it? We're going to dive into all of it, and I'll share what I've learned from top physicians in this field who are experts and up to date on the most recent studies and data. But before I go any further, I need to disclose I'm not a medical professional. This is not intended to be medical or professional advice in any way. I'm simply sharing what I've learned in hopes that you will work with your own medical team and get the help that you need. When I first started having hot flashes, I want to say maybe like 5 years ago, I remember asking my mom, how long does this nonsense last? I thought menopause was a year. I really did. I thought that was the thing. And she answered, "Oh, I think maybe about 10 years." What? I about dropped my chin to the floor. It was so unacceptable for me to think of going through that for another 10 years. I wasn't sleeping at all. The moment I would lay down at night, I would start hot flashing. I couldn't touch any part of my body. I couldn't have my legs touch each other, or I couldn't put a hand on my arm. It would cause a hot flash. I was so miserable. The moment I rolled over or moved, another hot flash. I couldn't wear sweaters in the winter, hot flashes all day long. Just so awful. It's a horrible condition to go through. And as you know, I'm a seeker. I was not satisfied to just accept it as part of life. But guess what? Most medical professionals will tell you it's just something you have to endure, that it's natural part of being a woman. Well, I love Kelly Casperson. I'm going to refer to her a lot today. She is the doctor I'm learning from right now. And she loves to say, well, guess what else is natural? Cancer is natural. Broken bones are natural. Poor eyesight is natural. They're all natural, but we treat them. And just because menopause is natural doesn't mean we have to just endure it. It can be treated safely and effectively. But I know firsthand that there are many doctors with outdated information and practices. A few years ago, I remember going to my OB appointment. I had a new OB. She had bought the practice of my former doctor, who I loved. Definitely not peri or postmenopausal yet. She was super young. Anyway, when I expressed how awful my hot flashes were and that it was disrupting my sleep and my sex life and I was miserable, you know what she said to me? This is great. You guys are going to love this. She said, "Oh, no, you just don't understand what a beautiful phase this is." And then she proceeded to give me a biology lesson about the female anatomy and why it was so wonderful. And then offered zero help. Nada, nothing. I left her office vowing I would never go back to her, and I have not. And from that point on, the search was on for me. I asked my friends what they were doing. I read posts in Facebook groups. I searched the internet. I found some really helpful suggestions, which led me to finding my nurse practitioner and getting started on hormone therapy. Perimenopause and menopause are not simply to be suffered through. You need hormones. Women's health has been vastly underserved in our country, and it's time we change this. I want you to consider for a moment, if a man struggles with his sex life for 1 second, he's offered therapies on the spot, Viagra, testosterone, whatever he wants. Yet if a woman struggles, we're told that's just how it is. And you just have to get used to it, right? And if you use hormone therapies, it'll give you breast cancer. That was something I experienced firsthand. One summer, we were leaving to go on a trip to Oceanside, and my hot flashes were so bad, I was just dreading it. I just didn't even know how I could travel. It was that bad. So the night before we left, I went into the Instacare to see if they could give me anything. I was just so frustrated. Well, the doctor finally agreed to give me 7-day supply of estradiol, but told me he couldn't give me any more because it would certainly give me breast cancer. This is not that long ago, you guys. So I took it and oh my gosh, it was like I was myself again. I could sleep. I wasn't hot flashing. It was such a relief. I had the best week on vacation. And then I ran out of pills and I was right back to being a hot mess again without any hope of getting help for it. So let's look back and find, where did this misinformation come from? Dr. Kelly Casperson is a female urologist. She's also a coach that trained at the Life Coach School, as I did, and she has made it her mission to educate women on this topic. She has an incredible podcast that I highly recommend. It's called You Are Not Broken, and I will link to it in the show notes. Please check it out if this is something you're interested into. There's so much good information there. But Dr. Casperson explains where the myth of estrogen causing breast cancer started and also why it's been disproven and severely harmful for women's health. Women are afraid, and the biggest way to get rid of our fear is to get educated. So here goes. There is a time frame for women when it is safe to introduce hormone therapy. That time is when perimenopause begins, which is usually about 5 years before menopause, until 10 years after menopause. So, roughly around the ages 61 to 67, because the average age of menopause is about 51. So, the time that you have perimenopause till 10 years after menopause. And menopause, you guys, is a 1-day event. Most people don't know this. I didn't know this, but it is 365 days after your last period. You get 1 day of menopause and then you're postmenopause. Okay. So anything after that date is considered postmenopause. Hormones need to be used for prevention, not after the fact. Okay. So if they're introduced in that safe window, women can take them for the rest of their lives. But here's where hormone therapy went off the rails for women in the US. In 2001, the Women's Health Initiative came out. It was a study looking at the question, does estrogen prevent heart disease? Well, the study founders leaked to the media that estrogen caused cancer, heart attack, stroke, and blood clots. The problem is they didn't track the right subjects. Here's the kicker. Those who reported these side effects were women who started using hormone therapy too late. Their study sample was of women in their 70s who, over the course of time without the aids of hormones, had built up a fatty streak or harmful plaques in their systems. And then when you throw systemic estrogen at those conditions, it destabilizes the plaques. And that allowed those older damaged cells to enter the body systems and cause strokes, heart disease, blood clots, and yes, breast cancer. So they threw estrogen at women that shouldn't have had it. And then they blanketed the recommendations for all women, which led to the denial of help for those who really benefited from it without the risks. If you take it during that safe window, you don't develop those plaques. You don't develop those fatty streaks. Those dead cells, those bad cells won't be destabilized because you don't build them up in your system. Okay. So one flawed study shut it all down. And unfortunately, most doctors have not been updated on current studies, so they continue to deny women estrogen. Estrogen hormone replacement can not only be safe, but I want you to listen to all of the health benefits of having it. The recent long-term studies of women receiving hormone therapy in the proper time frame found all of these benefits. Number one, it was effective in preventing osteoporosis. Number two, it was effective in treating vasomotor symptoms, meaning hot flashes and night sweats. Number three, it treats premature ovarian insufficiency. So it allows people not to go into menopause too soon. Number four, it improved mood swings. Number five, it decreased the risk of GSM, which is general urinary syndrome. Number six, it decreased incidence of macular degeneration. Any of you like your vision? I like that side effect myself. Number seven, it helps cure insomnia and sleep disorders. Number eight, it improves sexual function and vaginal comfort during sex. Number nine, decreased bone fractures, incidence of bone fractures. Number 10, it showed a decrease in cases of Alzheimer's and dementia. Are you kidding me? Listen to these side effects, my friends, these benefits, right? Number 11, it increased insulin sensitivity. Number 12, it decreased fatty liver disease. 13, decreases risk of type 2 diabetes. 14, it improves your skin. 15, decreases joint pain. I started having joint pain and I was like, am I getting arthritis? What in the world is going on? Once I'm on hormones, I don't have the joint pain anymore. It's amazing. Number 16, decreases depression and anxiety. That makes sense, right? When you feel good, your body feels good, your mental health is better. Number 17, it decreases cardiovascular disease by 30%. That stat alone is worth the treatment. And number 18, it decreases colorectal cancer by 30%. You guys, these are staggering statistics. If these kind of results were available for men, every single man in the world would be on them. Trust me, I feel like that's true. I'm not a man hater. I love men. My husband is the best. I just think that we need equality in medication. We need equality in medical treatment. Women's sexual health and functioning needs to matter just as much as the men's does. And we need government and everyone else to step up and support women in this. There are so many health benefits for women, and they have been denied to us all because of a flawed study and a faulty study. Before the WHI report came out, 40% of women were using hormone therapy. After 2001, they were cut off down to 5%. That means our poor baby boomers got screwed. My mom is part of that group. And the things that she suffered because of that contributed directly to her death. She suffered from osteoporosis. She broke her hip. She broke her back, her ribs, her wrist. She had heart disease. She had hot flashes and joint pain. So many of these problems. And guess what? She was given antidepressants instead of the hormones that her body needed to prevent these things. It's so tragic. It makes my heart hurt so much. I'm so passionate about this because the time is now for you. If you are in this window, all of you Gen X ladies, you have to take this seriously. You have to listen. I hope you will listen and find what you need. We have to undo the bias that was caused by bad information. Hormones are cheap and they are safe. And by the way, Dr. Casperson recommends non-oral estrogen because it is the best and it is the safest. Okay. I know it's easy to take a pill, but it has to be filtered through the liver. So, in order to make it as safe as possible, she recommends using gel or a patch or something called a fem ring. Okay. So, what do you need? Let's talk about the other hormones and their functions. Okay. So, every single woman needs both estrogen and testosterone. We have both, even though hormones have been genderfied, right? Like most people think that women have estrogen, men have testosterone. But fun fact, women actually have more testosterone in their bodies than they do have estrogen. Women typically have about 10% the amount of testosterone as men. And men also have both estrogen and testosterone. So fascinating, right? Our ovaries help convert that testosterone to estrogen when it's needed. And also, if you still have a uterus, you haven't had a hysterectomy, you need something called progestin. This comes in a capsule, very inexpensive, and that helps to protect your uterine lining. So there's 3 hormones to consider: estrogen, testosterone, and progestin. During menopause, when the ovaries slow down their functioning, estrogen levels lower, as do testosterone levels in the body. Just like estrogen, testosterone can be safely used as a hormone replacement therapy during menopause. There is not currently an FDA approved testosterone for women, and the main reason for that is money. Let me explain why. Because it's a naturally occurring substance, it can't be patented, which means the drug companies cannot make a ton of money off of it. So there's no motivation for them to spend a lot of money developing a testosterone therapy for women and getting it FDA approved. That is $1 billion process, and there's not a lot of profit in it. But don't let that derail you. There are treatments, testosterone treatments that you can get from a doctor. You might have to go to a specialist like a urologist because most OBGYNs don't regularly prescribe testosterone. They don't have that much experience with it. So you might have to look for a nurse practitioner or a urologist, someone who does have more experience prescribing those. You can still find it, but you have to find a practitioner who will prescribe a testosterone gel. It's called Testum at 10% of a men's recommended dose. Okay. So we've already discussed the benefits of estrogen therapy. Now let's talk about the benefits of testosterone as it has the potential to treat different menopause-related symptoms than estrogen. So here are some of these research-proven benefits. Now, these were taken directly from Dr. Casperson's website, and I'm going to quote them directly. The first benefit, higher energy. Fatigue, irritability, and decreased feeling of well-being can be symptoms of low testosterone levels in pre- and postmenopausal women, according to a 2022 article. Another study found that taking testosterone over a period of months helped decrease fatigue and lessen mood swings. Gosh, who doesn't want this? Ladies, I know we're all tired. We're all living on Diet Coke, right? What if we could just fix our hormones and have better energy? Okay, number 2, libido changes. Androgens, a group of sex hormones that include testosterone, are partially responsible for sexual desire, and androgen deficiency can lead to low libido during menopause. Research has shown that combining testosterone and estrogen therapy can result in the most improvement in libido. Oh my goodness, I have experienced this firsthand. It's amazing. So many people think they have to retire from sex because it becomes painful, right? Because their vaginal lining gets thin, it becomes painful, it burns. You can have all of those side effects. But with hormone therapy, and they have tracked women into their 90s who never went off of them, who are still enjoying their sex life. It doesn't have to end for you. Okay, the third thing, changes in muscle mass. Anecdotally, patients who are on testosterone report gains in the gym. A small 2014 study also found that the women in the study given the highest dose of testosterone had higher lean body mass and muscle strength and had more power with chest presses and on stair climbing challenges. Why does this matter? Listen, as we get older, we have to be able to support our own bodies. Nobody wants to be frail. We don't want to have falls. We want to be able to be active, and we do that if we have healthy muscle. Without it, we are weak and we're unable to do the things that we want to do. It matters a lot. Okay, number 4, improved mental concentration. Believe it or not, menopause can affect your mental clarity, and testosterone might be able to help. Poor memory and focus can be signs of androgen deficiency, and some patients have reported greater mental clarity on testosterone therapy. Anyone else here hate brain fog? You have trouble recalling things? This might be reason enough to get on some hormones. I'm just saying. I hate it. I do stumble at times and I can't find those words, right? Okay, 5, skin tone and texture. Some patients who have excess androgens have reported increase in acne, but a recent study reported that women taking testosterone experience improvements in the smoothness of their skin tone and its texture. Okay, and number 6, urinary incontinence. Okay, girls, listen up to this one because this is, especially if you have had children, you know that bladder and that area, that pelvic region gets weak. Urinary health issues, including incontinence and bladder leakage, can be specific to pre and post menopause. These can be signs of a decrease in testosterone. The 2021 study intended to treat arthralgias also showed improvement in urogenital symptoms. So, I don't know about you, but I don't like the leaky thing. And anything I can do to improve the health down there, I'm going to be all in. Dr. Casperson really does recommend a vaginal estrogen cream too, above and beyond your systemic estrogen that you might take. It's used just twice a week, but helps to improve the skin, all of the skin down there in that area. I haven't tried it yet, but I'm going to. I actually got a pill. I asked my nurse practitioner, she gave me a vaginal pill, estrogen pill instead of the cream. We'll see how it goes. If I decide it's not working the way I want it to, maybe I'll try the cream. I think my whole point in doing this podcast today is I want you to know that hormones are very safe medications. When you think about what types of drugs are given to people between anxiety and depression drugs, narcotics, and things like that, hormones are one of the safest medications in terms of risk profile to improve the quality of your life. So, there are 4 different available forms of testosterone. One is a topical gel called Testum. It's FDA approved. I think it runs about $20 a month out of pocket since it's not covered by insurance, remember. There's a cream that's available that's going to be a little bit more expensive and an injectable, but it's a little less common. It's harder to measure out exactly 1/10 of a dose that's given to men, but there are pharmacies that compound it and make it a little bit easier. Another option are testosterone pellets. This is something I have used. It's implanted under the skin on your hip, and they're given every 3 months, and they can actually produce, usually they're given a little bit higher doses. I've been using them for about a year, and I've really loved my results, but I think I might be switching over to a more traditional therapy of the gels and the creams, maybe a patch. I'm not sure. I just got another pellet, gosh, 2 weeks ago, but I think I'm going to switch over. The pellets are expensive, you guys, and you don't have to get into that trap. If you're going to be on hormones long term, it needs to be affordable. I plan to be on them for the rest of my life. So we've got to make it affordable. And if I can go from spending $450 every 3 months to, $60 a month, I'm all in on that. That's going to be way more cost effective. So I'm going to look into that and make those changes for myself. But it can be affordable. It can really change your life. Okay. Now that we've talked about all the benefits, let's talk about a few warnings. Who should not take hormone therapy? Currently, women who have breast cancer or women who've been treated for breast cancer should not be on hormone therapy without a doctor's close supervision. Women who have unexplained vaginal bleeding should not be on hormone therapy. Get to the bottom of that bleeding first. It might be a sign of uterine cancer. So you've got to be screened. If there is a cancer there, it can fuel the cancer, right? Smokers should not take hormone therapy. Active liver disease people should not take hormone therapy. Anyone with a history of stroke or heart disease, and of course, as we discussed earlier, women who are past that 10-year window after menopause. And ladies, I'm so sorry. I cry for you. I don't know what the solution is. Dr. Casperson says you need to speak with a professional and expert in hormones and talk about the risk and the side effects that might be possible for you. I'm not saying that you couldn't ever do hormones, but that's way out of my league, and you really need to do it under the close supervision of a medical professional. Also, testosterone shouldn't be taken if you're pregnant. As it could increase the risk of birth defects. And anyone who already has signs of excess androgens, such as a male pattern balding, or if you have PCOS, it may not be the best candidate for testosterone therapy. It is okay to take hormones if you have relatives with breast cancer, or if you also carry the BRCA gene. As long as you start within that 10 years of menopause, you should be okay. Also, don't use if you're not up to date on your mammograms and your other scans. Um, Hormones will not cause cancer, but it can fuel it if the cancer is already existing in your body. So make sure that you are up to date on your scans. By the way, do you want to know what has been proven to cause breast cancer? Let's talk about this for a moment. Alcohol is number one. There are 10 carcinogens in alcohol that cause breast cancer. Smoking causes breast cancer. Fat distribution in your body can be a contributing factor. An elevated BMI. So if you're overweight and obese, you can contribute to breast cancer. Inactivity can contribute to breast cancer. These are known factors to create breast cancer. Yet, because alcohol is a multi-billion-dollar industry, especially in the US, and the government makes a ton of money from alcohol, those warnings are not on there, but yet they have extreme warnings on estrogen. There are things we can do to prevent breast cancer, but eliminating hormone therapy is not one of them. My friends, I hope you've found this information as helpful as I did. As your coach, I care so deeply about your life experience. It's difficult to manage your emotional health when your physical suffering gets in the way. Please take good care of you. Get the help that you need so that you can enjoy every aspect of this big, beautiful life we are privileged to live. Cheers to your health. Have a great week, and I will see you next time. Hey, if you are ready to get unstuck and make your midlife amazing, be sure to hit that subscribe button so you don't miss an episode. And I want to invite you to join my Empty Nest Academy, where you will learn how to transform your mind, your relationships, and your life. Come free yourself of regret and disappointment and be so much happier. Listen, sis, we've got one shot at this big, beautiful life. Let's make it amazing. Go to JaneCopier.com, that's JaneCopier.com, and sign up today. And if you're not sure what's right for you, book a free consultation with me and we'll talk it over together. And we'll make sure to get you on the path that serves you the best. See you inside.